you here. During today's short lecture, I will explain to you briefly about 5 emergency medications which could save our life if we suffer from heart attack or become unconscious. So it's really important for us to understand how this medication works for the body to bring people back to life. Before we start to explain, now first let's have a look about the heart. Our heart, because this medication actually mostly actually help the heart to regain the strength. Now our heart is a very important organ which continuously contract and pump out blood, which carries oxygen and nutrients to rest of your body to provide energy. We know that blood carries oxygen, and heart actually pumps the blood with oxygen through the artery and then supply to rest of your body. Now this is our heart. The heart can be divided into 4 chambers, left and right side. Left side we have left atrial, left ventricle. Right side we have right atrial, right ventricle. From the left ventricle, the blood contains rich oxygen will be pumped through this aorta, which is the largest artery in the body. Through the aorta, from the aorta, it will then further deliver to the brain to rest of your body to provide energy. Now, first medication, then let's have a look. Adrenaline. Adrenaline is actually a hormone naturally released by your adrenal gland in your body to help you to fight against any stressful situations. So this is adrenaline help you to fight, to cope with the stress. However, our body probably don't have enough adrenaline. So if someone become unconscious or heart attack, now the doctor will inject adrenaline as a medication into a patient's bloodstream, into the blood, to help to boost the heart. So when the heart actually become really, really weak, cannot contract normally, the adrenaline can help the heart to regain the strength and to start to contract and pump out more blood out from ventricle to the aorta and then to supply oxygen to rest of your body. So this is the main function of adrenaline. And also adrenaline can treat serious allergic reaction. So if someone is allergic to something and if the allergy is very serious, we call this condition the anaphylaxis, means serious allergy to certain things. So if people have anaphylaxis, their area could become really constricted, really narrowed, and they will feel short of breath. And also the throat, the tongue, the face will become very swollen immediately. Also people could have rash all around the body in a very quick time. So adrenaline can be injected into the body to quickly dilate the airway to promote more oxygen flow into the lung and quickly relieve the swollen throat and swollen tongue as well. So adrenaline can be used to reduce anaphylaxis symptoms as well and can promote breathing. So that's adrenaline's function, but the main function is to make the heart contract harder. The second medication I want to introduce is aspirin. Aspirin can be given to prevent heart attack. The reason is that aspirin can prevent the formation of the blood clots by inhibiting platelet function. So we know that if inside our blood vessel, if the blood cells accumulate together, it can form the blood clots. When the blood becomes a clot, it could block the blood vessel and then restrict the blood flow through this blood vessel. And when the blood flow gets restricted, people could have a very serious problem. Now on the heart, actually on the surface of your heart muscle, now there's one very important artery which is called the coronary artery. Now if the coronary artery is blocked by the blood clot, then the blood could not flow into this coronary artery, and then the blood could not reach the heart muscle, because we know that coronary artery actually supply blood to the heart muscle to make the heart muscle contract. So if the coronary artery is blocked by the blood clots, then not enough blood could flow into the heart muscle, so the heart muscle will get damaged and people will have serious chest pain. So aspirin will help to prevent this chest pain by preventing the formation of the blood clot, especially in the coronary artery. So there will be more blood supply to the heart muscle and to prevent the heart attack. So if patients have chest pain, complain about chest pain because of the coronary artery disease, now you could give aspirin 300 milligram immediately, and it could possibly help. 300 milligram aspirin. Aspirin is very cheap and easy to buy from pharmacy without a doctor prescription. The third medication I want to introduce is the amiodarone. Amiodarone is a medication which is called the anti-arrhythmia. It actually corrects your heart rate. So if the heart rate become irregular, not regular, and very, very fast, now people could suffer a life-threatening condition, which is called the VT or VF. VT is called a ventricular tachycardia, a very fast heartbeat. VF is called the ventricular fibrillation. Fibrillation will cause the very irregular heartbeat. The heartbeat become very abnormal. So normally heartbeat is regular in the same between two beats actually have same time interval. So ventricular fibrillation is a very, very serious condition, which means that the heartbeat is not regular. So amiodarone actually helps to correct the heartbeat, make the heartbeat back to normal and become regular. So this is amiodarone. Next medication I want to talk about is atropine. Atropine actually can treat the slow heartbeat. If someone's heartbeat becomes really, really slow, we call it bradycardia. So the atropine can be given to increase the heartbeat, So this is the fourth medication. And the last medication I want to tell you is the GTN. GTN, the full name is glycerol trinitrate. This is a very, very important medication and needs to be given when people complain about serious chest pain. So glycerol trinitrate is made like a puffer, like a spray. So in a bottle, it's a liquid form. Now, if people suffer from coronary artery disease, we know that coronary artery stays on the heart muscle and to provide the heart muscle with oxygen, blood supply with oxygen. So the coronary artery, if it's blocked, the coronary artery become really narrow and stiff, and not enough blood could be flowed to the heart muscle, so the heart muscle get damaged. So if patient complains serious chest pain, now we can give GTN, glycerol trinitrate, to help to dilate the coronary artery, so more blood could flow to the heart muscle. So when the artery become dilated, now the blood flow inside the artery will be easier. The blood can flow in the blood vessel much easier. So the GTN, glycerol trinitrate, helps to dilate the blood vessel, dilate the coronary artery, to make blood easily flow to the heart muscle and to prevent heart muscle damage, to prevent heart chest pain, to relieve the chest pain. So this is a very important measure. Normally we give GTN as a spray, and the spray is under the tongue. We give the spray under the tongue. Normally we give 2 sprays at one time, And if 2 sprays doesn't work, then we wait for 5 minutes and then give another 2 spray, but have to be under the tongue because it only works better when it is dissolved under the tongue by the skin. GTN can be also designed as a tablet form. The tablet form is called the angenin. And angenin, we also need to place this tablet. Now, normally it's 300 to 600 micrograms. So angenin is a tablet form of GTN, and the dose is 300 to 600 microgram, and we also place under the tongue when patient complains serious chest pain, and it can also dilate the blood vessel to ease the blood flow to the heart muscle to make the heart actually works better. So GTN now I want to mention again. So 2 spray at once, give 2 spray under the tongue, wait for 5 minutes and then give another 2 spray. And if it doesn't work, wait another 5 minutes and then give another 2 spray. So maximally you give 3 times, and each time 2 sprays. It must be under the tongue to be absorbed better. And this is a very, very important medication to treat chest pain. So if patient have long-term coronary artery disease and then suffer frequent chest pain, and if they complain to you like they have serious chest pain, you have to immediately give GTN under the tongue and then call the doctor, call the ambulance to come to save the patient. So that's all the medication. That's some brief knowledge about this medication. And we will talk in further in detail about each knowledge in future. Thank you very much.